It's almost hard to believe, but CPR training has been available for more than 25 years. The Centers for Disease Control estimates that in that time, more than 40 million people have used CPR mannequins in their training. Using mannequins is integral to CPR training. In their entire history, there has never been a single documented case of an infectious disease being transmitted by a CPR mannequin. Consistent cleaning and disinfecting will minimize the risk of transmission of disease. There are several important factors to consider for both training and emergency aid. In actual emergency situations, healthcare professionals have moral, ethical, and in some instances, a legal obligation to provide CPR. For the layperson, the response to an emergency presents an individual moral and ethical question. A healthy rescuer should remember that the health risk from performing CPR is very low. Rescuers with impaired immune responses are at some risk of acquiring an infection during CPR, especially considering the emergence of tuberculosis in some populations. Such rescuers should consult their physicians about the risk of infection when offering CPR to a cardiac arrest victim. Also, any delay in starting ventilations could mean death or disablement for an otherwise healthy person. In training sessions, it is important to make sure students learn correct technique. But care must be taken to reduce potential risk within the classroom as much as possible. As for training in rescue breathing, obviously, mouth-to-mouth and mouth-to-nose techniques require physical contact to be effectively learned. Students or instructors with acute infections need to postpone taking CPR courses if they are known to be in the active stage of an infectious process, have reason to believe they have been exposed to an infectious process, or have skin lesions on their hands or in or near the mouth. If an instructor wishes to teach a person with a known chronic infection, such as the human immunodeficiency virus, hepatitis type B, or AIDS, exposure to other participants must be limited by using a separate mannequin for the infected person. The mannequin should not be used by anyone else until it has been cleaned according to approved procedures. People with chronic infections must not participate in CPR training until their physicians have reviewed their circumstances and indicated that their participation would be appropriate. Also, trainers and students should be made thoroughly familiar with hygienic concepts such as hand washing before mannequin contact, removal of lipstick to avoid staining the mannequin, and no eating in class to avoid food contamination of the mannequin. Before leading a training session, you should follow proper cleaning procedures and inspect each mannequin prior to use for signs of physical deterioration. Look for cracks, feel for breaks in the surface, and check to make sure the mannequin has been thoroughly cleaned. During training sessions, especially for two rescuer CPR, the mannequin cannot be adequately cleaned between uses by two students, especially when practicing the switching procedure. The recommended practice for this procedure calls for the second student taking over ventilation on the mannequin to simulate ventilation instead of coming into contact with the mannequin. Training in obstructed airway procedures also involves students using their fingers to sweep foreign matter out of the mannequin's mouth. However, practicing finger sweeps also contaminates the mannequin and the student by soiling the hands with oral fluids of previous students. The recommended procedure is to either simulate the finger sweep or practice on a mannequin whose airway has been decontaminated before the practice and will be decontaminated after each procedure. Between students, or after the instructor demonstrates a procedure, such as clearing an obstruction from an airway, the mannequin's face and the inside of its mouth should be wiped vigorously. Use clean absorbent material, like a fresh 4x4-inch gauze pad, wet with either a hypochlorite or alcohol solution. A thorough scrubbing and wiping is essential. Leave the surfaces wet for at least 30 seconds before wiping dry with a second piece of clean absorbent material. If reusable masks or other protective devices are used, they too should be disinfected between uses or, if disposable, changed. At the end of every class, the mannequin should be disassembled and thoroughly cleaned according to manufacturer's instructions. This should be done as soon as possible before the contamination on the mannequin surface dries. Those decontaminating the mannequin should follow OSHA universal precautions. Recent studies have shown that hepatitis B and AIDS viruses are not as resistant to disinfectant chemicals as once thought. However, a strict decontamination program will minimize the risks from even these diseases. Please emphasize to your students that mouth-to-mouth rescue breathing on mannequins has been taught for almost 30 years now. Also tell them that in that time, there have been no documented cases of bacterial, fungal, or viral disease transmission by a properly cleaned CPR mannequin. When you follow the guidelines demonstrated in this program, you'll be providing them with the safest class experience possible and helping them learn what to do in an emergency.